Perfect. Thank you so
Oh,
much.
I passed it to Ashley. Sorry, I messed up.
You're fine. I know my cues. Thank you so much, Olga, for that. I always enjoy your narrative medicine workshops. They are personally some of my favorites. So thank you also to everyone who raised their hand and was able to share out loud. We truly, truly appreciate you. And now, here today, we are transitioning to our panel of the day. And I just want to start by saying I am Ashley Freeman. I am the manager of Stakeholder Outreach and Engagement here with the Patient Advocate Foundation. And I have some powerhouses that I'm who are joining me today. And some of those are Allysa Dittmar, also Dr. Ifeoma Udoh, and also Jazmin Villavicencio-Bahe. And I'm excited because on this panel, as you get to hear from all of our panelists today, you'll hear the different unique but also similar challenges that each of their communities are experiencing when it comes to achieving health justice. And so I want to start there. In your introduction, in your quick introduction, please share with us, what does that connection to achieving health justice look like for you? And you can share a story either personally or professionally. And so we will start with Dr. Udoh.
Good afternoon, everyone. It's a pleasure to be here and share space with you all. My name is Ifeoma Udoh. I'm with the Black Women's Health Imperative. And that's a big question. That's a loaded question. And so I could start out by quoting some data and stats, but I think I want to lean into that a little bit and share a personal story, as you said, and sort of what draws me to the work that I'm doing now. The Black maternal health crisis in the United States, talk about an area where we really need to be doing better around health justice. It's the foremost in my mind when I think about my work at BWHI and when I think about sort of the cross sections of health and reproductive health, maternal health, all of that when it comes to Black women in this country. We rank 55th in the world as a developing nation with regards to our birth health, our birth outcomes. And Black women in the United States are 2 to 3 times more likely to die from giving birth than their white counterparts. And that's regardless of economic status. Being women who have access to health insurance or financial resources, that is not a protective factor in terms of protecting us from our health care and our maternal health crisis in this country. I find that incredibly unbelievable. And for me, what draws me to this work, I am a public health researcher. I've worked in public health for the last 20 years, but I'm also a mom. I have an 8-year-old daughter. I was one of those geriatric mothers. I got pregnant at 42, and I'm very pleased and happy that that happened to me. And also, I was the most fit that I'd ever been in my life. I ran a half marathon when I was 24 weeks pregnant with my child. And lo and behold, when it was time to give birth, I had one of those scary birth stories that we continuously hear about in our care systems. I was hospitalized for 8 days after birth. Luckily, the health status that I had, which was post-birth preeclampsia, I was still in the hospital when that was going on. So luckily, it could be treated while I was still there. But I think about that story with relationship to so many Black women who don't have access to health care, who don't have routine access to care in terms of their birth status, and how that impacts so many of us. And so I know that might have been a longer introduction, but I just, I think just contextually, it's really important to talk about how health justice shows up across all areas when it comes to Black women.
Thank you so much. As a Black woman who is in her mid-30s, Black maternal health is at the top of my mind every birthday. So I totally understand. And thank you for sharing that personal story. Next, we'll have Allysa.
Sure. Hi, everybody. My name is Allysa Dittmar, and I'm the Vice President of DeafHealth. This is a division of Communication Service for the Deaf, CSD. And CSD is a nonprofit that's been around for about 50 years, serving deaf and hard of hearing individuals throughout the United States. Our division is the Health and Patient Advocates Division, and I'm also a public health professional and researcher. I received my education and training from Johns Hopkins University, and my focus was on deaf health disparities and access to healthcare. For me, health justice is just simply being able to have communication effectively in your language and understand and access the healthcare system, education, resources, services. Really, communication is so incredibly important to us in the deaf community. There are countless stories that I hear and share, and I'll share my own personal story. A long time ago, really 5 years ago, I needed to have surgery. And of course, I asked for an interpreter. And it's important to understand that in our community, sign language, American Sign Language more specifically, is not the same as English. We have our own grammar. We have our own nuances as part of American Sign Language, and we have our own unique culture. So it's important for me to have an interpreter for my own health access. I am completely deaf. I rely on my eyes, and there was no interpreter provided in this specific situation. The entire experience, all of the staff had a mask on. I couldn't understand anything that was going on, to the point that I didn't realize that I was supposed to be signing a consent form that apparently is quite common. This happens in our population. We're given a form and we don't understand the form because it's a form that's in English, and English isn't our first language. And we don't get an interpreter that we asked for. So there's a lot of other traumatic situations that individuals go through. For example, asking a child who has deaf parents to interpret in an emergency situation because the hospital doesn't have budget for interpreters. Oftentimes we don't understand, or we deaf people misunderstand emergency announcements, or are the last to know what's going on. So all of these experiences and barriers in the healthcare system, research shows that us deaf signing community are 7 times more likely to have worse health outcomes. We have 7 times worse health outcomes as opposed to our hearing counterparts, regardless of our education level. So you could have a PhD and you're still going to run into these barriers that are in our healthcare system. So those experiences, both personal as well as experiences witnessed in our community, really drives my work. And at DeafHealth, we make sure that any health information is accessible and is culturally and linguistically tailored to our community. Every day we are advocating for access, and we provide direct support to patients. And lastly, we do things like this, working with organizations like this and foundations to partner with them and make sure that we all get access and that we are constantly educating every day.
Thank you so much, Allysa. I love that opening of communication effectively in your own language, right? And that's the important part. And last but not least, Jazmin.
Hi, everyone. It's so good to be here. Likewise. My name is Jazmin Villavicencio-Bahe. I am a member of the Chemehuevi Indian Tribe. I currently work as a program manager for the University of Arizona American Indian Research Center for Health. And I honestly love my work. I've been working with Native communities in the Southwest of the United States for the last 13 years, specifically in public health and research projects. And to me, when I was thinking about how to define health justice, I think that every individual, regardless of their background, their color, can have access to high quality healthcare when they need it. And in a lot of our tribal communities, some of us are in urban settings, some of us are in rural settings, and sometimes the healthcare, depending on where you are, doesn't look the same. And so that's what I would define it as having high quality healthcare when we need it. It's good to be here with everyone.
Yes. Thank you so much. And so we opened with people sharing their personal and professional journeys and connections with health justice. And a lot of that included some of the barriers and challenges that each community experiences. But I know that there's also good work happening, whether it's your organization or an organization that you know about, or just people in your communities who are advocates. So I want to give our audience the opportunity to learn about who are those change makers? What is happening? How are we holding each other close in this time as we transition through administrations and different things? So whoever wants to go first can go ahead and chime in and talk about those bright lights in your community.
I think that's a really amazing question because I do think, Ashley, that we have to hold hope in the forefront of our minds as we go through what I think is going to be challenging times for all of us in the upcoming years. BWHI, Black Women's Health Imperative, has been around for 40 years. It's a national organization that serves the health policy, research, and programmatic needs for Black women and girls. It was founded by Billy Avery, and those of you who know or work in anything with relationship to reproductive health, reproductive justice, and sort of that framework as a driver of what we think about health for women, she is an iconoclast in this work, and she has trained many women along her path and her journey in the lineage of the work that she continues to hold at BWHI. And so when I think about the warriors that are holding this space right now, I think about organizations like Sister Song and Sister Love, or BMMA, the Black Mothers Matters Association, organizations that are really holding that space of leadership and keeping their eye on the prize of what health access, health services need to look like for Black women. I think about our research partners and like Dr. Monica McLemore, Aisha Mays, who are women who are drivers in the work of thinking about maternal health strategies. And I think about our community partners. I think about our advocates in the field that we train across the board at BWHI. I think about what it means to sort of partner in those very intersectional ways, which I think we're going to need that more than ever as we move into the journeys that we're taking, because policy is a driver for change. And if we're going to change or create health justice in an equitable way, as my colleagues here expressed so beautifully about what we mean when we're talking about that, service and access to all, then really a key driver of that is that intersectional approach about how we think about policy. And so we've got to keep our eyes on the policy actions that are taking place that have the potential to set us back. So that for me is sort of where I lean into when I think about this work, because there are some amazing warriors, there are some amazing drivers of that work across the board, across all of our communities, and we need to continue to partner with them.
I guess I'll go next? I agree with that policy, protection policies and enforcement policies. Enforcing the laws is really important to make sure that the laws that are there are followed. And this includes the Americans with Disabilities Act, the ADA, as well as the Rehabilitation Act, the Affordable Care Act. All of these are foundational in order for us to be able to access healthcare in the first place. One example of being able to access important health information was actually during the COVID pandemic. The White House at the time, it was around 2020, was doing a lot of press briefings and giving updates, as far as quarantines and stay home orders and vaccine availability, updates on symptoms. Our community was the last to know what was going on because there was no access on the screen. Again, if you remember back to then, also captioning isn't always right. And also English isn't our first language. So this applies to other groups also who communicate in different languages. So one of the big change makers was the National Association for the Deaf. Their lawyers actually went and sued the White House for violation of the Rehabilitation Act because they were not providing interpreted access. Just like you're seeing right now in the picture-in-picture, having an interpreter there. That is what access is, as well as having accurate captions. So in 2020, the court did affirm our community and said to the National Association for the Deaf, yes, the White House was in violation of this. And this was a historical moment because this is the first time that the President of the United States was required to provide interpretation during these press briefings because it was such a crucial time, foundational for us to get information. And this is just really one example that happened. We get told all of the time about people who truly have no idea about what was going on. Back when hearing the stories about people washing their masks with bleach, I've heard about deaf people doing that because they didn't have any access to information. So protecting these policies and these laws in the first place is incredibly important.
I definitely agree. I think for Native American communities, our tribal leaders are really our first line of defense. They're our representatives. We have over 574 federally recognized tribes in the United States. Every single one of those tribes and nations are different. And so for us, it's really a lot of times having a voice, and the federal government, we have a very unique relationship with them. There's a trust, a government to government relationship within tribes in the United States. And so for us, it's really ensuring that the government doesn't undermine tribal sovereignty and that our voice is continually being heard, whether that is in health issues, environmental issues, policy issues. For us, to be perfectly honest, we anticipate potentially some budget cuts to Indian Health Service with the coming administration, just based on what we've seen in the past. And those kind of things can be scary when you think about Indian Health Service providing health services to a lot of Native Americans in the United States. And so I would say our tribal leaders and our elders are people that guide the work or should guide the work. And I think consultation, and when I say consultation, the government likes to use that word. They like to bring Native Americans at the end just to kind of hear what we think after decisions have been made. What I mean about consultation is making sure that's being done early on, right at the beginning, that if you're going to make decisions that affect us, that we're included from the beginning, not at the end.
That last statement was it, right? Included from the beginning, not at the end.
Yeah, I echo what you're saying, Jazmin, right there. From so in my role at BWHI, I serve as the Executive Vice President for Policy, Advocacy, Science, and that means that really what we do is drive policy forward with data. We drive policy forward with facts. And we try our best to drive policy forward using stories. Because a lot of times people don't want to see the numbers. Our policymakers sometimes get confused when they read the data, or they're not reading the data at all, clearly. But a lot of times what the other kind of story that really matters, or the other kind of data that really matters, is the stories, right? And it's the stories that our leaders tell us. It's the stories that our communities tell us. It's the stories that young women tell us when they are starting to talk about their menstrual cycles, and we hear a lot of stories around period equity in Black women and girls. We hear a lot of those stories. We hear a lot of stories from the families, women who are struggling with heart disease or diabetes, but they're the main caretakers for their families. And so how does that translate into what we're thinking about in terms of policy actions when it's difficult for them to access their Medicaid, and they go to the doctor and they can't access their meds? Drug pricing is impacted by these issues. And so we have to be willing to engage in that way with our leaders and hear the stories, because the stories actually are drivers of policy. And I think that what you said is incredibly important in terms of bringing that interest along on the front end instead of the back end. And there are ways to do that. There are engagement practices that are signed and true about what that looks like across each community. So I love that. That really that struck me.
Yeah, and let's dive deeper into that. What are some of those engagement practices? We talk about co-creation and respecting communities. What does that actually look like in practice for people who are here in the audience or listening to this and are boots on the ground, but want to have some tips on how this truly plays out?
I can start on this one. I think, there's so much more that we have in common than what separates us. And I think some of our communities have faced very similar issues or will face very similar issues. And I once heard somebody say, like, if you don't know your history, you're bound to repeat it. And so I think understanding what has happened, in our communities, learning from each other, and being willing to be a voice for each other. Sometimes, unfortunately, not everyone's at the table. So ensuring colleagues, the right people are taking the seat, they're at the table, and encouraging one another, saving space for one another, learning from our mistakes, and being able to share victories and celebrate those together. Because, when one of us wins, one of our community advances, we all really advance. We all really win a lot. We all benefit. And so I think working together, regardless of, our backgrounds, our color, unfortunately, we live in a very interesting time that we seem to be more divided. But I think remembering what brings us together, what makes us human, and finding the common ground and sharing our experience. I think those are kind of key practices.
One of the ways we try, just from a programmatic perspective around engagement strategies, is we have a program at BWHI CYL Squared, and it's Change Your Lifestyle, and it's all centered around supporting women and their families around chronic disease prevention. It is one of the only certified by the CDC training programs in the United States, and it's won numerous awards for the work that they do. And part of what we do with Change Our Lifestyle is that we're training community members and community centers in partnerships with everything from 100 Black men to fraternities and sororities to actually have patient advocates serve in the role of supporting people in their community as patient lay advocates, to get them into their medical appointments, to help support them when they're going to doctor's appointments, to ask questions, and knowing what kinds of questions to ask. And that might seem like a very sort of medicalized approach to thinking about care, but as we know, there's history around how Black and Brown people are engaged in healthcare systems. And so in order to sort of transform what that looks like, we have to have various different ways to sort of think about engagement. How do you bring people into care? How do you keep them engaged in care? And a lot of times it's not only or solely about the doctor interaction. A lot of time it's about the support mechanisms that are around them to encourage that access to care. It's that whole approach. And so having different ways to sort of incorporate those into your programming is, I think, really important and crucial when we talk about engagement.
Definitely. And I love that you brought up that it's not just one way, right? There's all these different factors that we have to think about and be mindful of, in order for this to really come to pass and to really come into fruition. And so one of my next questions is, for everyone, when it comes to, I heard my colleague Jamie ask Miss Lily Head this earlier, and I know we were all tuned in for that dynamic conversation. And she mentioned how walking into the future, and even right now, there has been a lot of divisiveness, so what would be each of you's call to action, for people who are watching this? What is that call to action and that change that every person can do in their own way, whether it's in their personal family structure, and how they're teaching their family about the different challenges with deaf communities. Or maybe it's something that they're doing on a community level or in their workspaces. So what would be that call to action to really drive that advocacy forward?
I'll chime in here. I think for me, constant advocacy is the work that we do every day, but also trying to remind people. I try to do this when I'm educating and sharing information, that we're all in this same boat together. And it might not feel like it right now, but in the future, you might lose your hearing. This could happen to you later on in life. Your experiences change. There could be some sort of chronic disability that happens later on. So advocating for accessibility isn't only the right thing to do, quote, quote, but it's also it applies to every single one of us. It can happen to all of us at some point. And I think that everybody will benefit from these positive innovations and creations. A lot of people have started preferring to use captions on videos or on social media or on TV's places. And even people who know English as a second language, they find that this helps their English understanding. So constantly advocating, educating, and amplifying voices. And I also recognize that this work is exhausting. And I think that a lot of advocates experience burnout and trauma. They get triggered. They are oppressed while working in this space every day. It can be quite difficult. So going back to what Gwen mentioned from the very beginning of this session, zero sum. I think we are all stronger when we work together in collective. I think we need that. Otherwise, we can't do this alone.
Allysa, You're hitting the nail on the head for me when I think about advocacy, because I think about it, particularly even more so now. I think about it in sort of these two lines of thought, but somehow we've got to keep intersecting them. And one of those lines of thought is focus on, so it's the policy P at the little level, I suppose, versus the federal level, because the federal level is going to start rolling down, and we're going to be very clear about what that looks like. The little level, the local level, is thinking about what's going on in your local communities, engagement with your mayors, your city councils, your board of supervisors, your hospital boards, your school boards. There's advocacy that we need to be thinking about at the level of how do we take care of ourselves and our local communities, and how do we ensure that the laws and the practices that support health justice together are being focused on at our local communities, at our state, at the state level with your governors. And I think some of that, because of the largesse of this last election, sort of got lost in the conversation. Like when we're talking about down the ballot races, that's what we meant. We're like, pay attention to what's going on locally too, because that is just as impactful as what's going to start coming down from the federal level. So I think about advocacy from that perspective. And then I also think about advocacy from the points that you raised, Allysa, about sort of the care perspective, the community care and the self-care. And I know self-care is a word that has gotten sort of blown up in our social media, but I'm thinking about things like checking on your people, turning off the camera at 5 p.m. when you've got to feed your kid, hosting family dinners and hanging out with your friends and family and showing up for each other in these ways. Taking the time, right? Like if your vacation policy at work says you have X amount of time off and you didn't take that X amount of time during the year. Americans leave the most vacation days on the books by the end of the year than any other country in the world. Like, we don't take time off. We don't, right? And so I think that when I think about care and what kind of advocacy is going to be needed for us really to survive over the next several years, it's what we're doing in our local communities to ensure that our laws and our policies and those practices at all those levels of government are reflective of the work that we need to see our local leaders to do. But it's also about community care and how we take care of one another as well.
I definitely agree. I was going to say awareness and advocacy, whether it is with one-on-one with a patient that's Native American, or you're a researcher wanting to come and do research in a community, or you're, in the federal government trying to work with tribes. I think the other thing I would mention is building a relationship and building trust. I think we all see that there's a lot of mistrust, not only in the health sector, but in the government. And so for Native communities, because of our history, just being aware that it's going to take a little more time. And it's not that we don't want the help, it's just that we need to know that you care enough and that you're going to really listen to our voices and do what we want from the community, not what your agenda is. And so I think making sure that we are taking the time to build the trust, to build those relationships. Something to keep in mind is tribal governments, every tribe changes government, sometimes every year, sometimes twice a year, sometimes every 4 years. So you need to learn about the community you're interested in working with, and take your time and be genuine, and because people will read that when you have other motives. So if you want to make a difference, just make sure people know that you care and that you're there with an open heart. And I think it was mentioned by the previous speaker, keeping humility. So keeping cultural humility is huge. Regardless of what community you work with, I think when you go at it with humility and a sense of being corrected and being told it's okay or not okay to do certain things, I think people will be more open to share information with you. And so those are just some tips in general with working with Native individuals, and just understanding, cultural differences, language differences. You can always ask questions. Never be afraid to not ask questions, as long as you come at it from a respectful manner. And so
I love that. And it's a through line that is so similar between all of your answers. That humility and that genuineness and that patience and the willingness to understand and learn and come, to the table as a person who doesn't know it all. And speaking of that, Hasmin, someone had a question in the chat about um, encouraging around clinical trials and academic research studies. And I know there's long histories about that. We talked about that earlier today. So anything that you wanted to speak to about that, Hasmin?
Yeah, there's been a lot of mistrust in research because there's researchers that have come into Native communities saying they're going to do something, and then they do something completely different that actually hurts the communities. We can learn that if you've never read about the Havasupai case, I encourage you to read about that. But research is great. And in fact, we need more research being done in Native communities. When you look at any research for any communities, we're not very represented. And I think a lot of it is because people are afraid to go through the process of getting approvals. A lot of tribes have their own research boards, their review boards, and some don't. Some is just as simple as going to the tribal council. So I would say develop those relationships, whatever you want to do, make sure that it's something the community wants as well, that there's mutual benefit, and that you have them from the beginning at the table planning that research study with you. And so making sure it's, participatory research practices are being used, and that it has benefit not just to the researcher or the university, but to the community overall. And then always, always report back your findings. Always, always make sure you do it in a way that the community will understand. But yeah, please look into doing research with our tribal communities. We need that a lot. We have a lot of young Native researchers nowadays too that we're trying to build up. And if you see one of those, please take the time to train us because we are hungry and we are ready.
And then Dr. Udoh, I had another quick question from the chat. Someone Jean mentioned that there's a lot of focus placed on equal access, but how do we shift that focus to also think about equal outcomes?
That's a great question. I'm going to start off by saying there's something that Linda Goler Blunt, who's the CEO of Black Women's Health Imperative, says all the time. And she has this sort of punchy statement about receiving the standard of care. And particularly when we're talking about Black maternal health or Black women as a whole. And she has this way of saying that we don't want the standard of care because the standard of care in this country is actually not that great. Like our health systems are actually leave us as a whole. And that's not just Black women, but it's all of us. And so if we're only seeking to get the standard of care, then we've got to actually do better than that. And when I think about that idea of equality and equal justice, that sort of rings in my head a lot when I talk about, well, what does that mean, getting equal access or equal care, when the standards of care can be very debilitating in this country, depending on where you have access to care, if public or private, insurance, non-insured, all of that. And so I think to the point of the question, one of the ways that we like to really think about our work and think about access versus justice or care is that what we're really trying to do is shift the definition of what does access mean. Does access mean you got to the doctor and so you got there? Or does access mean that there were things that were surrounding you as a person to support your care before it got to a point where it was so broken that you had to get to the doctor, right? Like there's different ways to think about how we think about access and how we think about care in this country. And I think we should be really focused on those ideas when we talk about health justice.
Perfect. Thank you. And Allysa, I'll end with you on any other points of hope or call to actions for us as we end this panel out.
I think that she hit the nail on the head. That was right on the nose. we can always do better than the status quo. The status quo is not good enough, and we need to move forward and into the future. We need to not have to fight just to keep the status quo, but we need to continue to push for better care for all of these different populations, while also recognizing that, yes, we are all diverse. We have different cultures, we have different linguistic backgrounds, we have different life and lived experiences. And that's the beauty in our advocacy work. All of our lived experiences make us experts, and we should recognize and applaud ourselves for really making those changes on a local level and advocating and educating, while at the same time bringing together and coming together with people of different lived experiences for a better future.
Perfect. Thank you. And thank you all for participating in this panel and really helping us to understand the different challenges as well as opportunities for hope and for growth in all of our communities, as well as the importance of all of us not being an asterisk or an afterthought, but being the important and central part of advocacy and health justice moving forward. And next, we will have a podcast excerpt from a conversation that I had on our podcast called Advocates in Action with Dr. Erica Concourse, who is a transgender attending physician, about their advocacy and different actions they have taken in their community to help with more understanding and knowledge around the LGBTQ community.